Greetings. My name is Vanessa Ledesma, Chief Operations Officer for the Caribbean Hotel and Tourism Association. Thank you for taking time to join the Caribbean Tourism Health Safety Training Series and today's session, COVID-19 Essential Health Guidelines for the Hospitality Sector. Before we proceed with the session, let's go over a few housekeeping items. All participants have been muted. You're encouraged to submit your questions for the panelists during the webinar by posting them via the Q&A box. Questions will be addressed at the end of the session. The on-demand video recording of today's presentation will be distributed within 48 hours of the webinar. Our session today is scheduled through 5 p.m. Atlantic Standard, 4 p.m. Eastern Time, and we hope you are able to join us through the end. We commend your commitment to health safety, evident by your participation at this session. Each individual that attends the session will receive a certificate of participation from CARFA. To receive the certificate, each individual needs to check in separately using the link posted in the chat. This is the only way that CARFA can confirm your individual participation and the documentation that will be used to prepare the certificate. To receive the certificate, each individual needs to check in separately using the link posted in the chat. Global industry research continues to highlight that prospective travelers place a high value to health safety programs as the top consideration when choosing their vacation destination and accommodation provider. It is vital for hospitality businesses to continue to train their teams and seek these resources that will help provide reassurances to visitors, employees, and residents. The Caribbean Travelers Health Assurance Stamp for Healthier, Safer Tourism from CARFA, endorsed by CHTA, CTO, and WTTC, provides a measurable and verifiable recognition regionally and globally. In 4 steps, you can achieve this recognition. Step 1, register for this Tourism and Health Information System, which will be reviewed during today's session. Step 2, report on this for at least 1 month. Reporting includes confirming 0 cases. Step 3, get your team trained. 10% of your staff attends this session, which is repeated to facilitate participation from your team. Step 4, upon confirmation of completion of the previous steps, CARFA issues the Health Assurance Stamp and provides listing on the Caribbean Travelers Health app. Upon receipt of the Healthier, Safer Tourism Stamp, businesses can apply to the CHTA Health Safety Commitment, which includes additional marketing tools to build customer trust, including the WTTC Safe Travel Stamp, globally recognized, available to non-members with a processing fee, and exclusively for CHTA member listings on CHTA's website and on CaribbeanTravel.com, our consumer online portal. We wish to remind you that the regional health and safety guidelines and checklists are available to download on the CHTA website and include detailed standards for all tourism sectors as well as individual sections by segments: ground transportation, accommodation, food and beverage and recreation and entertainment, including sites and attractions. To the CHTA members joining us today, we value your continued support and encourage you to maximize the resources and tools available to you. If your company is not a CHTA member, you're missing on valuable resources to support your business continuity. We need and want your involvement. Join the MyCHTA community today by contacting us at membership@caribbeanhotelandtourism.com. As a reminder, to receive the certificate of participation, each individual needs to check in separately using the link posted in the chat. This is the only way that CARFA can confirm your individual participation and the documentation that will be used to prepare the certificates. We now show you a screenshot of how it looks when you click on that checking link. Just go to the left and enter your last name or your registration confirmation number. Again, it is important that each individual checks in separately. At this time, we would like to introduce Dr. Lisa Indar from CARFA, who will lead the first part of the presentation. Dr. Indar, over to you.
Hi, good afternoon, everyone. Let me say season's greetings. While my presentation is coming up as we share the screen, this is the last training for this year. Of course, we will continue next year. The training that I'm going to do is divided into 2 parts. Can you please confirm that you're seeing my screen?
Yes, we are.
Great. So this training, COVID-19 health guidelines for reopening the health hospitality sector, this is it's twofold. It's meant to really provide a certificate of participation, which is a prerequisite for getting the healthier, safer tourism stamp. But more importantly, it's meant to guide you as you open your businesses to make sure or to ensure that you are implementing the COVID-19 health guidelines so that you can make your service a healthier and safer service. This is the outline. I'll speak up very briefly on the program, on the stamp, and then we go into the COVID-19 measures, followed by an introduction on what is the Tourism and Health Information System and how you can register. So our tourism and health program is a relatively new program. It's a couple of years, well, about 4 to 5 years old. But the difference with this program is that it is really meeting your need, the travel or the hospitality sector. It's innovative and it's multi-sectoral. It's the first of its kind in the region. The goal is to enhance for visitor and local health and safety, to build travelers' confidence, tourism resilience. And we're addressing this through addressing all those health, safety, and environmental threats through novel things. A web-based tourism and health information system, which is a THIS system. Vanessa would have mentioned this. Through training, this is one of the training. We also do advanced food safety training, international certifications, and so on. Through standards, we have developed a set of standards that are regional standards that will become operational and required for the Caribbean next year. Through another set of partnerships, the Travelers Health Assurance Stamp for Healthier, Safer Tourism, and through the Caribbean Travelers Health mobile app. So these are the different tools that we do have to enhance your visitor safety and tourism resilience. I want to say here, this is available to every single country and every single entity, regardless of what area you're from or which country you're from, even though we would have started these programs focused on certain countries, because we are the Caribbean Public Health Agency, whatever we produce is available to all. At the moment, and I say at the moment, all of this is free, of course, because it's funded by a grant. When there is no grant, there will be a cost. But at the moment, all of this is free. So the tools is the early warning and response system, which is the THIS system. This is a real-time information system. It's your own free internal health check-in system. It's confidential. All we are requiring you to report are syndromes. If somebody has fever or gastro or diarrhea or so on. And the system is so cool in that it does its own calculations and it tells you, what type of, from the symptom, what syndrome you have. And then it gives you an idea in terms of what is a threshold if you need to respond to it immediately. Like for instance, one case of fever, hemorrhagic fever, is something you need to respond immediately. But for one case of diarrhea, it could just simply mean someone, just had a change in water supply or change in country and so on. So it allows you to do that. So it's called an early warning and response. If you report, you will be able to have early analysis for response to reduce spread. And the reason we developed this system is that we would have had many outbreaks in our hotel and tourism sector. One such outbreak, started on the eve of one day with a few cases, and overnight, this was a bug that was being spread with, a viral spread of a viral bug that was being spread in a hotel, one single hotel. And it went on, to 50 cases overnight. And of course, that wasn't reported. And because it was being spread by person to person, it went on to 300 cases by midweek. And then by the end of the week, over 1,000 cases. So at that time, you could not reduce spread. At that time, it was too great. There was negative repercussion. The name of the hotel was all over the internet. People weren't coming. And there was a reduction, a 30% reduction in tourism for that country. So just tells you how quickly disease spread. And if this system was being employed very quickly, the minute you start reporting, this would have triggered a rapid response. The other thing that to support this system, we have guidelines on how you respond, and who should respond. When you have a cluster or an increased case, you need to know what is the appropriate response. How you respond to gastroenteritis is going to be different. How you respond to fever and respiratory illness, which may be indicative of COVID. So it tells you that. We do not always only collect data from the hospitality, but we are collecting from our cruise ships, from our laboratories, our hospitals, our health centers, and our public health agencies. Now, so this mosaic of data is really meant to compare, to really find out what's happening in the region. And interestingly, it's our public health agencies who call us and says, well, we have had, a number of persons visited this hotel. They can tell us which hotel and what date, and they can tell us the names. And, they have gotten sick, and what are you all doing about it? So trying to cover up is not the best thing. The best thing is to be able to report in a confidential manner and let the system work so you can have rapid response. We do a lot of capacity building. This training is one of them. We do advanced food safety training. We do HACCP. We do outbreak investigations. I spoke about standards. We have developed 7 clean and green health and safety standards. These standards meet local requirements or national requirements, regional, international, the federal tour operators, the ISO requirements, and they have already gone through a process that they have been endorsed by ministers of trade and standard. They are going to become the CARICOM standards that later on we would then be inspecting against. We have a lot of partners, as you see some of them here, not just the public health agencies like the Center for Disease Control and so on, but the cruise ships and the international agency, Cruise Line International Agency, the CTO, the CHT. And as we accumulate all this, and when COVID came, it really pushed us to come up with a measurable health assurance stamp so that our travelers will have that enhanced confidence to come. But more importantly, we can measure the facilities that are implementing proper public health measures. And with that comes our app, which gives you a central depository of all the different health advice, alerts, and so on. And it also tells you which are the healthier, safer facilities that has been awarded the stamp. So this slide really talks about how we have revamped our work to respond to COVID. We have had extended our guidelines for reopening. The tourism and health information system, it's more user-friendly. You can register by Google Doc. Within 48 hours, you will get registration. We have expanded it to include the tour operators, self-reporting. We have the stamp, we have the app, we have the tourism task force, and that is between CTO, CHT, the OECS, and the Global Tourism Resilience Center. So this working relationship we have with CHT is very close to build healthier, safer tourism, to protect the region, as well as to build travelers' confidence. Every week, we do weekly travelers briefs and travelers advisories that is there on our website, country reopening measures, and it's on the app. So every week that's updated, and we have also updated our website. So how do you really get this stamp? The first is that you must be employing the COVID-19 proactive measures. The first 2 is what you need right now. It means you have to participate in this training, which is the COVID-19 health training. You have to participate in it, and you must get a certificate of participation. If you don't have the certificate of participation, then you cannot fulfill that requirement. You must have the certificate of participation, and you must have been registered in the Tourism and Health Information System and reporting. Only when you have these 2, then that's the first requirement that allows you to get the Traveler's Health Stamp. And I want to reiterate, we keep getting a lot of requests, well, we have participated in the training and we don't have the stamp. You can't get the stamp unless you have done the training and you're using the tourism and health information system, which is part 2 of this work. Following this, next year, we will upgrade into tier systems where we will add the standards and so on. If you get the Traveler's Health Assurance stamp, you will be getting an email stating that you have been awarded the stamp, and then every facility that has the stamp will be on our app on that green tile. The Caribbean Travelers Health app is unique in that it has all these different color tiles. The green tiles tells you all the facility that has been awarded. So up to the date, we only have 7 that has been awarded. However, we have over 500 hotels and other tourism establishments that has registered into the system, and we are waiting to see that they fulfill the requirement of the participation and using the system. So registration into TIS would not get you the stamp. You have to be using the TIS. So using the TIS and going through this training will get you the stamp. So I hope I'm being a bit clearer here, because I really want you to understand it's not just to register and leave it there. We have a requirement to the travelers public to show, look, you are going to an establishment and they are doing these proactive measures. On the app as well, you would see, the pink tile will tell you the list of the different hotels, the travel requirements, the vaccine requirements, and the hotels that have been registered. There's a blue part in the tile that tells you what are the country opening requirements, whether it be testing and so on. It tells you about prevention measures. The tile, there's a part of the tile, the yellow tile, that takes you straight onto our website and so on. So the app is very user-friendly. Both the app and the stamp was launched on November 5th. So I'm sure you're going to see familiar faces there by Ministry of Health and Tourism. We have a running video that we will show that shows the West Indies board endorsement. Sandals has endorsed this, and they're working towards getting all their hotels on board with the stamp and so on. So we are promoting, and we will keep promoting. It is in your interest to get onto the app by getting the stamp. To get the stamp, you go through the training and you use the system, and it means you are doing a proactive measure, and you will get free publicity on the app.
Travelers now have the added assurance of a healthier, safer option when coming to the Caribbean.
The Caribbean is paradise. We've got lovely people, wonderful cuisine, beautiful beaches, and most importantly, a rich history of Caribbean flavor.
CARFA, the Caribbean Public Health Agency, is committed to promoting the health and safety of travelers coming to the Caribbean through its novel Travelers Health Program. It allows for real-time monitoring and response of public health issues, supported by training and health, safety, and sanitation standards for our hospitality community. It also provides a measurable Caribbean Travelers Health Assurance Award stamp to hotels and guest houses that are implementing proactive health monitoring and safety measures. Facilities with a stamp are identified on our Caribbean Traveler Health app as a preferred, safer option.
We don't only have the best cricket, but healthy and safe environment.
There is no better time than now for us to work together to ensure that the Caribbean is globally acknowledged for its healthier, safer tourism.
The aim of this program is to improve and enhance the well-being of both our visitor and our local population.
CARFA, promoting healthier, safer tourism.
Okay, so that video is available. You can use it, and we will keep advocating over the next couple of months. You would see, CHT and us joining together to keep advocating. I want to tell you now, this video tells you how the stamp. So that tells you how to get the stamp. And finally, the Travelers Health app, which I was speaking about, facilities with the stamp are identified on the app. So it's your free marketing. And this shows up the icons on the app. The app is very easy to download. Go and look for Caribbean Travelers Health app. It's available both on the App Store, Apple Store, and on Google Play. But travelers will now have that added assurance for a healthier, safer option. Okay, and of course, any questions, contact us, Cyrus, or Miss Onella Cyrus, or any one of us, so that you would know a bit more if you are getting any issues. So you notice we are saying this over and over on how to get the stamp. You register following the training today, register for this, you use it, you go through this training, we will award you the stamp. Once we can verify you have done both, you will be identified on the app. This has been endorsed by the World Travel Tourism Council, and the CHTA also, persons who have been awarded the stamp will also be awarded the Safe Travels stamp as well. So that takes us to the end of this particular part. This is how we can be contacted in our list at CAFA.org, Cyrus on orn@cafa.org, and we're also on social media, and these are our numbers. So now I want to go into the next part of this training by talking about COVID. For this part, I'm going to take you through, okay, sorry, I was just fixing a slide. For this part, I'm going to take you through what is, the background or the microbiology of COVID, so that we can understand why we need certain prevention measures. In terms of some background, we know that this is a pandemic. It was declared a pandemic on the 11th of March, 2020. We first saw it in sometime late December, but by March, it would have gone through and spread throughout the region. It was called a pandemic. In terms of today, we are over 69 million cases worldwide, and it's going to be the second, it's the second worst pandemic. However, it may more than likely be the worst pandemic in the history of our world based on the numbers. And 2 days ago, it surpassed in the US as the most common cause of deaths. So before, it used to be non-communicable diseases and so on, but now it is the most common cause of deaths in the US. So this is ravaging. It's a very serious illness. I want you all to take it seriously and think about how, as we open our tourism industry, we can move towards putting the enhanced prevention and control measures that would allow us to really stop the spread of COVID. Now, the risk to the Caribbean is high. What do I mean by that? Persons can come in and they are coming in from high-risk areas, meaning you are seeing the numbers in the US and the UK and Canada. Worldwide, the numbers are very high. In fact, compared to what we see in the Caribbean, their numbers are much, much higher. So as people travel, the risk continues to be high. However, we want to ensure that we open travel safely. Tourism is our major economic driver. This comes down to your business being viable. You don't want to open your business and close it down because of a COVID or another type of viral spread. So this particular training will help you to implement the COVID measures that will help you with any other bugs that will then reduce spread. So what is COVID-19? Well, let's start by saying it is a new virus. So because it's new, we are now finding out about it. And as we find out, we update our training. It belongs, though, to this family of coronavirus. So, people say, well, yes, the coronavirus has been out there long. Yes, but it's a different type of coronavirus. In that same family, you have SARS. You may have remembered that, in 2002 and 2003. But as you're in a family, you have brothers and sisters and they vary. They're all in the same family, but they differ as well. And that's the same with COVID-19. It is different. It has not been identified previously in humans. And as we go along, we find out more about it. So it is new. The other thing I want you to know is this is a virus. When I hear the word virus, the first thing that comes to my mind is the common cold. You have your kids at home and you would tell them, if someone has the cold, you will say, stay away because that person have the cold and they will transmit it to you. Well, it's the same thing and even more vigilant with COVID because, because it's new, our populations are virgin populations. We do not have the immunity to build up against it. So it means we are susceptible, and this is why we're seeing these number of deaths and so on. So, come a couple of years down the line when our populations have developed immunity, when vaccinations have come and so on, we would have developed immunity and the numbers will be low. So if you remember Zika and chikungunya, it was the same, well, not like this level, but the numbers were high in the beginning. And as the population developed immunity, it reduced. So because it's new and because it's a virus and a virus can spread very quickly from persons to person, we want to ensure that you stay apart or stay away from persons to reduce transmission. So the virus is transmitted from person to person. It can be transferred. Now, to just back up, it's an upper respiratory tract infection. Where does that mean? It resides in my upper respiratory tract. So if I'm coughing, if I'm sneezing, if I'm talking loudly like I am right now, if I'm projecting my voice, if I'm singing, those tiny droplets, if I have COVID, is going to be transmitted out. It's going to be transmitted to the air, and anyone standing next to me can pick it up, or it can be transmitted onto a surface, and then someone touches that surface and touch their eyes and nose and pick it up and get sick. So it is as easy as that. So it can be transferred from persons to persons via these tiny droplets from your nose and mouth. And when the person sneeze or cough or sing and so on, or it can be transferred by contact, meaning I sneeze onto a surface and someone else then picks up, touches that surface and touch their mouth and their nose and so on. This is the primary reason we wear masks and why everybody should wear masks. Because When a person is speaking, you are not seeing those droplets. It's very tiny. You are not going to see that. You are assuming that, the person is not transmitting. And remember, it can be transmitted by persons who do not even show symptoms. The other reason we wear masks, we may then transmit it onto a surface, and someone may unknowingly pick it up from the surface and then touch their nose and their mouths and pick it up. So the mask prevents that transmission. The other thing we need to know is that it can also be transmitted by direct or indirect contact with infected secretions, by bodily fluids like blood and sweat and saliva, sputum, nasal mucus, vomit, urine, and diarrhea. And it may be spread by individuals that show no symptoms. So I may be looking healthy, but I could be transmitting COVID. So it's important for me to wear a mask. The third thing that is alarming about this new illness is that the data shows it can spread from 2 days before until 14 days after onset of illness. That is huge and it's alarming. And this is why we have that quarantine of 2 weeks, because persons can still be spreading illness. So we keep them apart from others. If someone is positive, we keep them apart. Or if you have been in contact with someone who may have had COVID, we keep you apart for 14 days because we do not want to risk that transmission, that risk of transmission or spread. Now, the science, and I know some of you all are reading a lot last week, the Center for Disease Control would have brought out that the highest risk of transmission is the first 7 days. Yes, but there's data that shows it can carry on. So what the CDC is saying, that you have to show a negative after 7 days, and you have to show daily monitoring to ensure that you are not transmitting. There is no evidence that COVID can be spread by food or by water or mosquitoes. So it is not, like dengue or so on. However, in everything we do, we now need to implement these COVID measures to prevent, for food safety and mosquito-borne prevention as well. This slide really shows how it is spread. The person is coughing, sneezing, or talking, those tiny droplets, you're not seeing it, but it lands on surfaces. Any surface, I can be speaking right here, it's landing on a computer. That's one of the most common ways, because everybody touches a computer, they touch all the keyboards, and then they touch their eyes and their nose and so on. Someone else then comes and touches that surface, and they pick it up, and then they touch their nose and their mouth and eyes, and then it transmits. And why is all this so important too about the surface? Well, COVID can stay on surfaces. So this is the current data. It can stay on cardboard for 24 hours. It can stay on wood and cloth for 2 days. So imagine that if you're continuously wearing your uniform and you didn't change it, it could keep transmitting. It can stay on glass and banknotes for 4 days. So if we are not cleaning and sanitizing our glass and other utensils, it can stay. And if we are handling money, it can transmit. So this tells us how we can better prevent. And finally, and I think even worse than all of this, it can stay on plastic and stainless steel for up to 7 days. So all our plastic bottles and plastic containers and all our stainless steel, like in our kitchens and so on, if we don't deep clean and sanitize, COVID can stay. The other bug that stays long is also norovirus, which is also a virus and stays long on surface and can be transmitted from person to person. So if we protect against COVID, we will be protecting against other viruses that can be spread very quickly as well. So that's what is COVID and how it is spread. So what do you look for? And this is good because all of you all can become disease detectives. The first thing you have to look for is fever. Fever is defined, anything above 37.8. Some people use 37, some people use 38, but it's just that elevated temperature. The only way you can know a person's temperature properly is to check it. This is why you see people with those thermometers, those thermometers guns, because you have to check. You can't watch somebody and says, they look like they have fever. But the first symptom, and the one that is constant throughout with COVID, is that you must have fever. You can have fever with or without these rest of other symptoms. All right. Most times you have a combination: fever with or without cold, both dry and productive, shortness of breath, fatigue, tiredness, and so on. So anytime, and I want to emphasize this, anytime any one of your worker or you see any one of your patrons in your tourism facility or your tourism service that looks sick, that has a fever, that is coughing, you immediately put that person apart in a separate room, which is called quarantining. You put them apart and you call a doctor. Don't wait to say till you get back from the tour, or don't wait to say, well, they're having dinner. Don't wait for anything. Put them in a separate room, call the ministry so they can be tested. And I say that because we are seeing how quickly COVID is spread. You don't want to risk another minute. They can be tested and they may end up being negative. Or if they're tested and they are positive, then every single person they have been in contact with will then need to stay apart and be tested. So it is that serious, guys. And this is one of the ways we reduce spread, by being able to do very, very quickly in terms of symptoms and spread and so on. All right. Now, the other thing we need to know, remember, some people may show no symptoms. And then we also need to know that older adults and persons with medical conditions may have a delayed presentation of fever and respiratory symptoms. So moving on. Okay, but he is on the flight. Okay, I'll find out. Okay, sorry, I really had to take that when I was in an urgent call, else I wouldn't have taken it. Okay, moving on to how severe this illness is. Most of the cases we're going to see are mild. So let's start with that. I may have COVID and I may appear to be healthy. I may have a mild fever. In fact, it's even milder than the mild cold sometimes. I want you all to recognize that. It's so mild that you would not even recognize or appear to be looking ill. So most people tend to be mild to moderate. The problem we are seeing is that the persons who are severe and critical, they tend to get really bad illness and some of them end up dying. All right. So we are seeing, for instance, in the US, thousands of deaths per day. Who are the critical or most at risk? Persons who are over 60 and persons who have underlying illness. Now, this underlying illness could be as simple as a common cold. Obesity is an underlying illness, that has been overweight, heart disease. You may have other things, but it may give you it means that your immune system is not full enough to prevent against this. So therefore you are at risk. We have seen a lot of people die. We have seen children dying. We have seen people who are in their 20s and their 30s and appear to be healthy, and they have died because perhaps of an underlying illness. And of course, the most people at risk are the older persons, with some form of, heart disease or non-communicable illness. So you may ask, why am I showing this slide? I'm showing this to let you know, people who are mild to moderate, they don't get tested, they don't wear masks, they don't see it as important, but they may transmit this to another person who may end up becoming critical. So I'm saying this to you, that part of what we are doing is to wear a mask and stay apart so that we don't encourage the critical and the severe cases if we happen to be a mild case. All right, moving on now to our COVID-19 definitions. There are a couple things to clarify so that as you open your businesses, you will be able to look for. One is the imported case. The imported case is persons who have been exposed to COVID-19 abroad, and they didn't have symptoms. When they arrive, they come back with symptoms and they test positive in the country. So like a daughter returning from a university. That person then goes to their family, and a person in their family, they transmit, and that person, their family, gets sick. So a local person is a person who have no travel history, but they were exposed to an imported case, and then they develop symptoms. And this is when we see little clusters, in our country, we see little clusters. And at that point, it's still easy to control, because you can keep apart, you can isolate the person who has the symptoms, who has been tested positive. You can quarantine, meaning keep apart those who have been in contact with this family member, and try to reduce spread. The issue arises when you have community spread. Many people in the community has developed the symptoms and tested positive. You have no travel history and you're really not sure of that link. Now, community spread happens when people keep lingering. So maybe that local spread person then went to their work and didn't wear a mask, or didn't social distance, or did not stay apart, and they continue spreading the illness because they didn't appear to look sick, but they continue spreading the illness. When you have community spread, it is very difficult. And I also want to say, when you have community spread, according to the CDC, you will be at a level 3. So you will be getting a traveler's alert against your country. So we have to do our little parts here to ensure we are not encouraging community spread by making sure that we are doing all the right things as well. So I've said all of that to come to this slide. This to me is the most important slide, because if we can implement these measures in our day-to-day activities, whether we have a hotel or a guest house or a tour operator or a taxi service or a yachting service, whichever it is, if you can implement this as part of your routine, just as how you get up and brush your teeth and wash your face and so on, it becomes routine. If you implement these 7 measures, then you will play an important part in reducing the risk, in breaking transmission, and most importantly, you will encourage a sustainable business. You will get people to come in. People would not be getting sick in your business. You will encourage, more and more arrivals, more and more return. So because we know COVID is transmitted from person to person, the prevention means we stay apart. So the first is we stay 6 feet apart. Not 1 foot, not 2 foot, but 6 feet. I see social markers that are sometimes 1 foot apart. That's not appropriate. The data shows that when we talk, this respiratory illness, depending on how loud you talk, can go as far as 6 feet. And in some extraordinary cases, it can go as far as 10 feet. So we do not want to risk it. This is why the data shows a minimum of 6 feet. So how do we keep people apart? We need to have social markers. And those social markers must be at least, all right? So it could be more, but at least 6 feet apart or 2 meters. You need to have social markers in every part of your business, not just at the entry, but at the entry, at your dining services, at your recreational, at your pool, at your bar areas, in your bus stores, and so on. You need to have the social markers so you prevent the crowding, and you prevent persons being in close contact. The other thing is important is hand hygiene. We know it is spread from person to person, and when you touch surfaces and you pick it up and then you touch something else or you touch your face and so on. So if you wash your hands, you will be removing the bug from your hands. I will go through what is the proper hand washing. The third is face mask. We spoke that it is transmitted through these respiratory droplets. So if I wear a face mask, I'm preventing COVID spread. I'm preventing me from spreading COVID, or I'm preventing a possible person from infecting me, or I'm preventing droplets to fall on surfaces where someone else can pick it up. So the mask is very, very important. All persons must wear masks in the public, If you're in a family setting at your home and you already have that established connection, you may not wear a mask in your house. But if once you come out in the public, you need to wear a mask. Cough and sneeze etiquette. If you're coughing, it means, that projection of particles. So you need to cover your mouth. Use a disposable napkin, which you throw out. Don't keep that because then you keep contaminating. Or if you don't have a napkin, you cover with your elbow. And if you are sick, stay at home. Do not go and just help out in the busy times. Do not say, they don't have a bus driver today, I'm going to work. I really have to get, this money. I may be transmitting COVID if you do that. So stay at home and seek medical attention. We now know that if you have a mild fever, you may have COVID or not. The best way is to be tested so that you are ruled out. And finally, you want to avoid contact. So the things that we like to do, we are the Caribbean people, we love to hug, we love to touch, we love to handshake. We now have to stop doing it. The more we do it, guys, the more we encourage it in our business, someone will pick up COVID. And you know what? They don't have to be looking like they're sick. They will pick it up. They will spread it to their homes. They will spread it to other people. We will have local and then community transmission. And then our businesses would go, would be really impacted. Our economies will be really impacted. So you all play this very, very important part for your employees as well as all your visitors to ensure these measures are put in place. So therefore, every establishment, tourism establishment, because we are talking to tourism facilities here, should have these general health guidelines. First, temperature screening. You must take temperatures. Even though a person has just arrived from the airport, they are coming to your establishment, so you are now responsible. So anyone that comes through your establishment, you should take temperatures, use a temperature gun. At no time should you be touching the person's skin surface. If you touch a person's skin, you then have to sanitize your thermometer. So invest in those thermometers gun that can take temperatures from at least about 1 meter or 2 apart. So you don't have to go too near. You can take a thermometer at their forehead or at their hand, it doesn't matter. The other thing you need is hand sanitizers. Now, people will use your hand sanitizers if they see it. Don't just put the hand sanitizers at your entry, but you need to put it everywhere that that involves any form of contacts. Your driveways, your reception areas, your lobbies, your restaurant entrances, convention spaces, elevator landings, pools, salons, exercise areas, and so on, all need to have hand sanitizers. So when I go to hotels, now that we are opening, that hotels have opened, in front is really looking nice. But as you go to the back or you go to the recreation area or you're going to the dining room, you're not seeing the hand sanitizer. It needs to be everywhere. You need to have proper house signage, front of house signage. And this is where you can get innovative, and this is where you can, use your own, your own hotel logos and so on your mask, on your signage. We care about you, we protect your health, wear a mask, stay apart, let's greet each other differently, and things like that. Social distancing, I spoke about this. You need to have social markers to ensure social distance. And this has to be all throughout your property. If you're doing a destination, if you're doing a tour, it has to be in your buses. When you go to the place that you're touring for, must also have that. Your recreational areas, your boats and so on still has to have that 6 feet apart. You need to wear face masks or face covering. And, people should lead by example. So you wear your face coverings. So if you're a husband and a wife that is managing a business and at home you don't wear a mask because you're at home, once you're in that business, so once you're out in public, you still need to wear your face covering. And finally, back of the house signage. This is important because it really helps maintain your safety and your health and safety of your employees. So signage is important at the back of your institution as well. Okay, so I've spoken about COVID, how to prevent, and what are the general guidelines. I'm going to touch a little bit about some specific areas throughout, the hospitality industry to talk about some other key points. So the first, let's start with transportation. A person has arrived, whether they arrive, by A or C, and they're coming. The first point of contact and the first point of possible transmission can be the guest transportation once they leave that airport. So the bus or whatever transport that is picking them up has to ensure that all persons in the vehicles should continue to wear a mask at all times. So I want to encourage this, because if people are not wearing masks at all times, those respiratory droplets are then going to go onto your taxi service and they will stay there for long periods. So we just spoke about how they can stay there. So ensure they wear a mask. The travelers should not mix. What do I mean by that? If you have a family of 6 and you can carry all 6, that's one group. But if you have a family of 6 and then they had another friend who is 1 or 2 persons, that's 2 separate groups and they cannot mix. The only time you can carry those 2 groups is if you have a big bus and you can ensure they are 6 feet apart. So persons in a cluster, a wife and a man and his wife and his kids, can stay together. They still need to wear their masks, but if you are transporting them together, the other group must be 6 feet apart. The third is that they must perform hand hygiene. And of course, we know you can't have a hand washing station by your bus, but you must have adequate hand sanitizer. And the hand sanitizer is not to just press and spray a little bit, right? This hand sanitizer is going to be like a hand wash. So it has to be a full palm full where they can take, and you have to watch that they are putting it all around their entire hands down to their elbows. You know why? Because if COVID is in their hands, if they're touching their eyes and their mouths, COVID is in their hand, they can touch your surface and contaminate. And finally, you need to sanitize the interior of your vehicle after the patrons exit and before another group comes in. So yes, the work is a little harder, but you don't want to encourage spread. You do not know who is coming. It can be a very severe person or a person at risk. And a person who are likely to be at risk. And then they may pick up 1 or 2 COVID bugs, 1 or 2 counts of COVID. And because they're at more risk, they may end up being a severe case. They may end up dying. We cannot afford those types of risk. All right. We are small countries. We can't afford reputational damage. So you need to also sanitize. So that's at our transportation. The guest has now come and they're arriving. Once they arrive, you check the temperature. Again, use thermometers, use masks, social distance. Try to have a thermometer that can be able to point and shoot at someone, the temperature that is, as far as possible. Ask them to use hand sanitizers and wear face masks. And this is the time to have added face masks. Sometimes people may come in and they will not have a mask. So you either refuse them entry or give them a mask, right? And we can't break these protocols because it's too risky to break. It's too risky to your business and to the viability of your business to break these protocols. You may say, oh, that's my friend, I know them. Oh, that's a little child. She does not need to wear a mask. The answer is no. So this is a time where you put your nice mask. You can use your hotel logos or a nice welcome sign on your mask and so on. And you can give it as a token of entry. You want to have signage and of course to ensure that people are social distancing and so on. And the employees should not open the doors of cars or taxis. So the person has arrived, they would go through guest service, and reception, social distancing, sanitizing, mask, and so on. And then at the other area for contention is your elevators. People tend to be crowded, and people also, when they're in the elevator, they touch everything. So it's one of the greatest part of greatest risk to infection. You have to have someone who is cleaning those rails all the time, and if possible, have someone to operate the elevator knobs, or if not, keep sanitizing between uses. And this is a tricky one because lots of people touch the knob, then they're going into their rooms or going somewhere, they will touch their eyes and nose, and the spread continues. The other thing in elevators, you have to reduce your numbers. So if you're 8, you have to reduce to 4. So post signage outside, post hand sanitizers outside every elevator. So people will sanitize and reduce the risk of contaminating the rails and so on, because people will go and lean up on the elevator and touch the railings. So those are the elevators. Moving on to guest rooms. The guest should be assigned a room that has been thoroughly cleaned and disinfected. And the proof of disinfection should be invisible. All right, so not just cleaning, but disinfection or sanitization. And that you should also have a sanitizer in each room so that the persons can use it to keep, reducing spread. Let's move on to employee health and personal hygiene. I want to start by saying the status of health in your establishment depends on your employee health. So we need to ensure our employees are healthy and they are doing proper personal hygiene. In that way, to reduce disease spread. So let's start with personal hygiene. So before COVID, we have to ensure our employees, you have to have a checklist. Bathing, short hair, or if you have long hair, well kept, short nails for everyone across the board, clean uniforms, and so on. So those are the general things. They must wear hair nets or hair caps. They must have short nails, including the cashiers, and they must not wear their uniform to work. Those are some things that we know, and I'm saying this because those have been contributions to illness. They must go through training. Though some people may not be able to go through, a sit-down training, you may have to demonstrate for them. In terms of some other measures that specific to COVID as well as disease spread, you need to encourage hand washing and proper hand washing. The only way to encourage proper hand washing is to have the necessary equipment. So you need to have hand washing stations, not just for your visitors or in the front, but at your back by your employee rooms, so they can always be washing their hands properly. The other thing is training. All employees should have proper training, and depending on their areas, you do COVID-specific health training for them. And that should be, all areas, your housekeeping, food and beverage, operations, down to your security and your valet and your door and your belt services. All it takes is one break. You say in a chain, the chain is as strong as its weakest link. All it takes is one person. The maintenance guy may not wash his hand or may not wear a mask, and then he transmits it to someone else, and the cycle goes on. So you need to ensure everybody's doing the right things when it comes to COVID reduction. Third is personal protective equipment. Appropriate PPE must be worn. What does that mean? Well, first, you must have proper uniform. You must be covering your hair. You must have, short nails. And in addition to all of that, you must be wearing a mask, right? There is no exception. Even if you're cooking in the kitchen and the kitchen is hot, you wear a mask. Or if you cannot wear a mask in the kitchen, you wear a big face shield, but then you don't talk at that time. And any employee that is sick, stay at home and get tested. So how should we wash our hands? This here is the only proper way. If we reduce or we take a sidestep, we are not doing proper hand washing. Proper hand washing can be done with soap and water or alcohol-based sanitizer if you do not have soap and water. So the preference is soap and water. If you don't, then you use a sanitizer. The process is 20 seconds. That's a long time. And what I do is I sing the happy birthday song, or Mary had a little lamb, or some things like that. But for the process, I would just ensure that helps me get through that 20 seconds. What is the process? You wet hands with water. All right. You apply enough soap to cover all parts of your surface. You rub hands palm to palm, down, you're going between your fingernails and up and down and so on. That scrubbing process takes 15 seconds. When you finish in that rotational type scrubbing, you rinse, you take a clean paper towel, disposable towel, you dry your hand, you use that same towel to turn off the faucet. Then, only then you use hand sanitizer, because you clean, then you sanitize. After that, you take another paper towel to open the door of the restroom. Because if you open the door of the restroom with your bare hands, you can recontaminate your hands with what is on the door. All right, so that's the general process of hand washing. And it's better to have these hand signage. You see how this is picturesque? People just be able to go through the instructions very quickly. Now, if you don't have soap and water, you can use an alcohol-based sanitizer. In this case, the sanitizer is going to be your hand washing, like your soap then. So you have to have enough where you have a palm full of the product and you're using the same process of, hand washing, scrubbing and so on. And in this case though, you do not rinse off. This too also takes 20 seconds. So anything under this is not proper hand washing. So one of the things we can do for all our employees is to ensure they do that. And we need to put these signage all over to ensure our guests are doing these proper things as well. Okay, now let's move on to cleaning and sanitizing. Cleaning is different from sanitizing or / disinfection. And you need to clean first, then to sanitize. Cleaning removes the dirt and sanitizing kills the bug. If we only sanitize and we do not remove the dirt, then some of the bugs will be hidden in the dirt or the debris and they would not be killed. So the first thing is to clean. Cleaning is using soaps and detergents where we remove dirt and debris, and they can remove some germs like bacteria and viruses, but it doesn't kill them. So you use soap and water and detergents and you clean. Then you use a sanitizer, whether it be heat or liquid or chemicals, which can be in liquid form, and you use that to kill the bug. There is nothing that gives you 100% kill, but most sanitizers, a proper sanitizer, will give you 99% kill. All right. Now, the type of sanitizer to be used is going to depend, on what you're using it for in terms of the concentration. Like, for instance, hand washing, the sanitizer must show, if it's an alcohol-based sanitizer, it must be between 60 to 70% alcohol. And that alcohol could be isopropanol or ethanol, but not methanol. All right, so you have to look up some of these to decide which is best. We can't recommend, we can only tell you what it should have on it. So we must clean, then we sanitize. What I see, especially in dining tables, as soon as someone picks up, you take a sanitizer spray and you spray the table. Well, now that is not good enough. You need to first remove the dirt and debris. We know COVID can stay on surfaces. You want to clean first, then you sanitize. What should be sanitized or disinfected? All your high-touch surfaces should be cleaned and disinfected regularly. What do we mean by regularly? Well, in the ideal scientific world, Every time you touch something, you should disinfect. We know that's not possible. So we tell you as regular as possible to reduce spread. Things like your telephone and your fax machines, elevator. Well, this is for a hotel, but depends on what you're doing. Elevator buttons, toilet faucets, bathroom showers, light switches, staff, remote controls, and so on needs to be disinfected. We did an outbreak for another viral outbreak, and we found that this virus stayed on the light switches. It even stayed on the pictures in the room, right? So it tells you how quick and how far it can spread. And it also tells you that you need to clean and sanitize all high-touch areas. Moving on to face covering. There are 3 types of face coverings: a medical face mask, a respirator, and a non-medical face mask. The one that is recommended for our everyday use is the non-medical face mask or cloth mask or community mask. These can include many types of self-made, or do-it-yourself mask. And it gives you a chance to put nice, welcoming messages like hello and have a nice day and so on. It is not approved for medical purposes, but it's really meant to create that barrier to prevent that spread through respiratory droplets getting to the surface or to someone else. However, it is only as good as it is dry. Once you get sweaty and it gets wet, or you're overusing it and it gets wet, you need to change it and take another mask, another dry mask. The second one is those medical face masks. Those are those blue and yellow ones you tend to see. Now, those are for the frontline workers, like say CARFA or the health centers or the medical centers, the public health workers, those frontline workers to use those. They are cleared by the Food and Drug Association. They're using healthcare and healthcare workers, and it protects the wearers from these droplets and controls the spread because they have to be more in close contact with people. The third is the respirator. These are meant to be used by persons who need them because, again, they're in short supply. And you use those for persons who need help in breathing or by healthcare workers who are in areas like ICU and so on. So those are the general types of masks and when you use and who should use what. How do we put on a mask? Well, of course, you perform hand hygiene, which we just spoke about. And to put on the mask, you need to hold the mask by its strap. That's what's important. And you pull the strap towards your face. Don't touch the mask inside or outside because of contamination. Depending on if you're wearing a cloth mask, when you're finished, you hold the strap again, you take it off, and you put it into a Ziploc bag that you can then take back home to wash it. Or if it's a single-use mask, you throw it away. Let me say something here on single-use masks. It is only meant for single use. So those disposable masks, if you wear it once, it means you jump in your car and you went to get something and you didn't have your cloth mask, but you use a disposable mask, then you have to throw it away as soon as you're finished. Do not leave it in your car and use it again. Don't say, well, I only use it for 5 minutes. It's okay if I use it again. The answer is no. It's meant to be disposable. Moving on to food safety. We spoke that COVID cannot be transmitted by food, but we need now to include the COVID-19 health measures as part of our food safety practices. What do I mean by that? And I'm repeating myself here. In addition to your uniform and so on, and your hairnets, you need to also wear a mask in the kitchen. In the kitchen, in your dining areas, in your serving areas and so on, it's the same that apply. Wear your mask and stay 6 feet apart. So it means your kitchens cannot be crowded. It means your dining areas can't be crowded. It means your pickup areas cannot be crowded and people need to stay apart. What do we do for our pools and spas and other recreation? And this also applies to our beaches. There's no evidence that COVID has been transmitted by pools, by hot tubs and spas, nor beaches. However, the thing that here is important is the equipment and the spread through equipment and persons to persons. So you need to ensure you're monitoring people. You need to have enough people by your pool and your beach and your other recreational areas to ensure you are monitoring them, okay? So that if a person is there, they are staying 6 feet apart from others. They can stay with their family in a cluster, but if they have another group, that group has to stay 6 feet apart from them. Anything they touch, the chairs, the tables, the toys, the pool safety equipment, high-touch surfaces and so on, needs to be cleaned and sanitized before someone else comes. So that long time we would have been able to just have somebody move from a pool chair or by the bar or, and so on, and someone just picks up a seat. You cannot do that anymore. You have to sanitize, clean and sanitize before someone else uses it. So we need to have more pool attendants, more recreational attendants, more bar attendants, more dining room attendants to encourage this. The other thing we need to be vigilant about is kids. Kids do not understand COVID. They would not understand why they need to wear a mask, why they need to wash their hands, why they can't hug and touch everyone, and so we need to be vigilant for them. We need to watch them. We need to clean and sanitize around them and, what they touch. We also need to ensure that, that we don't get persuaded to hug and touch them because, they're kids. This is where the family stays vigilant and try to be, those are the only persons that should touch their children because of the likelihood of COVID spread now from person to person. What are some additional tips for recreation? So all our recreation, whether it be water sports or other beach sports and so on, the same principles apply. You wear your mask, you stay apart, you clean and sanitize all your equipment, your hand hygiene and so on. So you have to now take that into your type of activities. So all your equipment and high touch areas must be sanitized after every use. So you may need to invest in some more life vests and some more snorkels and so on, because some of them may require soaking in sanitizers like your goggles and snorkels before someone else uses it. You need to limit your passengers. So to allow for that 6 feet apart, your capacity may be about 60 or 70% or less. If you have a lifeboat that can only take 4 people, then you may end up being 2 people to keep them apart and so on, as an example. All right. You want to ensure persons are performing hand hygiene, and they must wear their mask except when they are bathing. So if you're doing a water sports and they're not in the water, they still has to wear their mask. So like that girl who is kayaking, she should be wearing a mask, like how the guy who is cleaning the equipment there. The only time they're not wearing their mask is when they're in the water. If you're doing tour operations, you treat the tour like if someone is now coming into your hotel. You do your temperature checks. You ensure they wash and sanitize. They wear face masks. You ensure they're staying apart through physical or distancing and through floor markers. And you ensure that the equipment and so on are clean and sanitized. And if it's feasible, do a one-way traffic. And remember, when people have gone on a tour, they're coming back to your hotel, you go through the same thing. If they're within your hotel, you don't need to do temperature checks every day because they're in. But if they have gone out on a tour, when they come back in, do your temperature checks and so on. For dining areas. So just like in our pool areas where we have to reduce numbers and encourage social distancing, it's the same for our dining areas. So our tables now need to be 6 feet apart. Our tables must only allow for one set of group, so you cannot have mixing. Sometimes they may have these big tables and you put 2 groups, that's no longer possible. Our tables and chairs must be sanitized after every use. So it's no longer just the table, but also the chairs and anything that was on the table to be clean and sanitized between uses. You need to also have barriers or plexiglass at your customer point so that you reduce the risk of infection. Right? We just spoke about organizing seatings. If you have any prepackaged food on the table, like, your ketchup and sachets and so on, you either throw that away or you clean and sanitize before you put it. Your menus, if it's a paper menu, it could only be single use unless you laminate it so you can clean and sanitize, or you can have a computerized menu. And after that one set of persons leave, you need to then clean and sanitize before the second person. So you see how I'm trying to tell you, you encourage mass sanitization, social distancing in every single activity you do. So that takes me to the end. I want to leave you with this prevention and control video, and I will answer questions before we go into the tourism and health information system. So that takes us to the end of this training, and any one of our videos, they are on our website. Please feel free to download and you can use them as well. So that takes us to this part. I would open up for question and answers if there are any.
Thank you, Dr. Inder. Dr. Frank has taken care of a number of questions on the Q&A. But I do know that there were a few questions that have been repeated from previous sessions. So one is with regards to the use of the mask. I know you went through it, but if you can refer to it again in terms of how long should a mask be worn? And also if somebody suffers from allergies and things like that, what alternatives or any other recommendation that you can provide to those individuals?
Okay, thanks, Vanessa. So the general rule is that you can wear a mask for 4 hours if you're doing one task, right? So if I'm only in the kitchen and I'm doing one task, I'm wearing that mask for 4 hours. If that mask gets wet or moist, I have to change it. It's the same thing like gloves, okay? Same thing with masks. If you have allergies, if you have breathing issues and so on, and you can't wear this mask, it's restricting, then we recommend the face shield. But with the face shield, remember, if you're speaking, those respiratory droplets could come from under your face shield and still go out. So if you're wearing the face shields, you can't speak.
Perfect. And just as a reminder, this is not the end of the session. This is just the end of the first part of this session. You're required to stay through the end to be able to receive the certificate. And to that note, I'm going to ask Alexis to post on the chat again the check-in link. We do have about a quarter of attendees that have not checked in yet. And unless you register, you will not be receiving the certificate of participation, which is one of the requirements for the stamp. We do have a few quick questions. How do we clean pillows and mattresses between guests?
How do we what?
How do we clean pillows and mattresses between guests?
Oh, So those has to be washed thoroughly. And so the pillows would have gone through and the pillows and the pillow sheets and the bed sheets would have gone through normal washing, high temperature washing and so on. And really, that should be enough unless somebody has been sick. If somebody has been sick in that room, which will show up, through, you would see vomit if it's something else, or you would have known through the person had COVID by retroactively, then you have to separate and deep clean that room and sanitize. So deep cleaning, deep sanitizing if someone was sick. If not, proper washing and cleaning should be enough. And there's a lot of other, I don't want to use particular products, but we should just be extra careful. You could sanitize the bedspreads, the empty beds, sanitize the pillowcase, the pillows without the pillowcases before you, put them on.
What about mattresses? I think, did we cover?
Yes, so the mattresses, if you're taking out the sheets, and this is something that is important too, because we know it can stay on surfaces and on cloth. It's best that you change sheets daily. We know it's more work, but it's best you change sheets. And when you're removing your sheets, it's best that you spray sanitizers on the mattresses, on the bare mattresses, and it's best practice then on the pillows, and then you put clean sheets and so on.
From a spa perspective, do you recommend that resort open spas? What sort of protocols, procedures they should have in place to be able to be in business?
Yes. So this is a common question. And this is where, it's very hard because you're in close contact. You are touching the person. So here you have to be extra vigilant. We cannot recommend closure. What we recommend is extra vigilance. So you do not speak, you wear your mask, you're touching the person. That person shouldn't be speaking at all as well. So if you're doing a massage, or if you're doing your nails and so on, those things, your speaking is not allowed, you're wearing your mask. And in this case, you can't social distance. Mm-hmm. So things like, sanitizing before you come in, bathing, like if you're doing massages, they need to bathe, they need to clean off before you come in and things like that. And this is where the testing and all that comes in, like spas and so on do require a PCR test, need to show that you're COVID negative. You have to be even much more vigilant with this because someone may come in with COVID, and persons who are in the spa has to be tested regularly as well, because now you are touching someone or you are in close contact with someone.
Yeah. We're going to take one more question and then we're going to go to the next section of the webinar. Persons coming into Dominica with a negative PCR test are tested upon arrival with a rapid test. Sometimes it shows a positive result and person is then given another PCR test, taken to mandatory government quarantine until results come back. Most times it is negative. So I was wondering if these tests are foolproof.
So that's a very complicated question there. So I will answer this way. Every test, the test that we do recommend is a test that shows greater than 90% sensitivity and specificity. The only test that shows that right now is the PCR test. It actually shows 99.9%. So in the very, very rare, which is 1 in 15 or 16,000, you may have, one thing going, one source of error. So the PCR is pretty good like that. The rapid antigen tests can be used for situations, to do like a secondary test, but that test is not for diagnostics or it's not proof for entry. If Dominica has added that additional test, that's Dominica's protocol. Each country has their own protocol, but for entry, point of entry, it should be PCR. Once you're using a rapid test, you have the risk of a false negative as you may have indicated. So we have to think about that. Yeah.
And I'm going to make this question because it has never come up and it's a very good one. For housekeepers, do they have to change their masks in each room that they attend?
That's a really good question. So I go back to the science. They're changing, if they're changing their tasks, so it means they're changing one room to the other, they should change it.
Okay. Okay.
Yes. To
Alexis,
be more proactive. Yeah.
yeah. Alexis, if you can bring up to the screen the slide that shows the steps to receiving the stamp. We had a few questions, and just for the benefit of anybody that may have joined late, the Healthier, Safer Tourism Stamp is a recognition stamp. It is not a certification. One of the requirements for receiving this stamp is participation at this webinar by 10% of your staff, who will then receive a certificate of participation. So 10% of your staff need to attend and receive a certificate of participation. The other two steps are that your business has to register for the Tourism Health and Information System, this. And once you register, you have to report for at least a month, which includes reporting 0 cases. Once these 3 steps are completed, CARFA then reviews, approves, provides the stamp, and then also lists the business on the mobile app. So just for reference, this information is also available on the CHTA website for anybody that wishes to review in depth. And then once a business receives the CARFA Healthier, Safer Tourism Stamp, your business is able to apply to the World Travel and Tourism Council Safe Travel Stamp, as well as for CHTA members, exclusive listings on our website. With that being said, I'm going to ask Dr. Frank to take us through the second section of this webinar, which is a review of the Tourism Health and Information System. Dr. Frank, over to you. Dr. Frank?
Yeah, so I'll just finish on one question.
Yeah. We do have an
Yes.
echo. Yeah, okay.
Okay, are you seeing the slide?
Yes, we are. We have.
Yes.
We are seeing the slide, Dr. Frank.
Others. Okay, can you hear me now?
Yes, we can.
Right, sorry about that. And is my screen visible?
Yes, it is visible.
Okay, nice. Okay, so continuing on with this afternoon's training, we'll be looking at the second part of today's training, which will be the sensitization of our TIS system. So TIS stands for Tourism and Health Information System. So we'll just be looking at this presentation, and then afterwards, we'll leave a few more additional moments for questions, so that if anyone has any questions specifically related to the TIS program, they can be answered. And then also we'll continue answering any additional questions persons may have had with respect to mask, etc., that may have gone unaddressed before. So the TIS system is our early warning and response system. So it is a web-based real-time application. And when we say web-based, it means that persons will be receiving the information as soon as it is entered into the system. And why do we have the TIS system? TIS is a tool which is used by the Caribbean Public Health Agency, and it is an implemented tool under the Tourism and Health Program to ensure safer and comfortable travel within the Caribbean region. Why did this system begin? Now, this system started before the COVID-19 pandemic, and as we all know right now, it is an ideal tool to be used to combat the COVID-19 pandemic and to return and reintroduce tourism and travel to the region. How it works is simply all of your data will be confidential. No names are required when you are reporting. Persons or hotels will not be targeted. So when we say that hotels and persons will not be targeted, It means that the information is confidential. We will not be using it against you. We will not be using it as a means of highlighting any hotel's issues or that they have particularly had multiple incidents in their facilities. We are not about that. What we are trying to do is to ensure that you have better and more improved measures to prevent disease transmission. And when we talk about disease transmission, we do not just mean COVID-19, but we're referring to also other respiratory diseases and foodborne diseases, etc. Our data is not published. It is not a hotel tracking system, as I just explained, so we'll not be specifically monitoring any one hotel or country. And it is actually an internal health monitoring and alert system for your facility and by extension, the country. So it, in other words, ensures that you don't have any reputational damage to your country or to your facility. A very keen example that I tend to use would have been a few years ago. Outside of the Caribbean, there is a facility in the Mediterranean. They had multiple outbreaks and they were unaware that they were having these outbreaks. So the outbreak was actually originating because of contaminated orange juice that they were getting from a facility, and they were serving it in their kitchen, in their breakfast menus. And what was going on is persons were returning to their country in Europe, and Europe was able to flag and realize that they were originating from this Mediterranean state. When epidemiological investigations were implemented, it was found that this hotel was actually the cause of this disease outbreak. And this disease outbreak had actually been going on for 2 years. So this is a very good example as to how you can get reputational damage, because needless to say, it really was a big stir in the travel community. In addition to that, it would have also had the implications where persons may have taken legal actions. And then we must also remember the reputational damage that would have occurred. So the hotel was actually closed down for a period of time, and in addition to which the country would have been named. So to ensure that we do not have this and we promote sustainable travel and tourism within the Caribbean, we have to ensure that we have certain protective and proactive measures to protect ourselves. So I'm just going to show you guys how our surveillance pathway works. You will have the regional organization, which will be CARPHA. So the Caribbean Public Health Agency serves as the regional organization. We monitor the tests. And in addition to that, you will also have the National Ministry of Health. So your Ministry of Health will have a focal point, the epidemiologist in your country. They will also receive alerts. They will receive facility level to investigate any alerts needed. And there'll also be an ability for them to aggregate any national data and identify trends. Now, I want you to remember that this program is used by your guest and your staff. So a very good example is if, let's say, your country has a vector-borne disease outbreak, it now helps you to understand, is that my clients, meaning my guests, are coming down ill with this vector-borne disease? Is it that my staff are coming to my facility, coming to work, having gotten it at their home? So remember, the reporting system will help you to now understand, is this a national issue also? Is it a issue where persons are coming to my country with this disease? Because remember, we're also taking into account the country of origin. So this is why it's very important when we're disaggregating the data. It has data entry and data analytics. So remember also, our data is always safe, confidential. We do not take your login information. We do not know your login information. All of your information that you input into the system, we'll be able to monitor it, yes. And I just want to assure you that it will be kept safe. Now, the facility has 2 persons who will be doing the data login and monitoring. You'll be able to report cases of illnesses in real time. And when we speak about that, we mean the data entry clerk, and the other person who will be able to monitor will be the manager. So we'll go into it later on when we look at how data entry clerks and managers have 2 different appearances to their systems. So the data entry clerk will be able to put in, for example, if a coworker comes in ill, he or she will be able to put in that report with the person. Or if a guest also has a problem, they can input that information. However, they will only see that page. So they cannot see previous inputs or future inputs. As in, if I input something today, I can't look later on Friday to see if anything happened on Thursday. I can only see what I have done and input it. Meaning it has to be real time. So as soon as you send in that entry, you will not be able to see it normally. The manager of the facility, however, has access to look at the full listing of any entrance into the facility, meaning that he or she will be able to pull up the reporting files and be able to pull up the graphs and any other Excel sheets that come with the reporting. So the self-reporting feature is what we normally have for your guests and staff also, meaning that they may not have to come to your data entry clerk, they can report it themselves. And we encourage that persons get their staff to feel free to anonymously report any illness that they may have or feel at your facility and also your guest. Now we have alert notifications. So we'll go into our alert notifications shortly. Alert notifications are our method of generating whether this is significant or not. So we have threshold values which are inputted into the facility, into the TIS system, and they are also generated based on the number of rooms and based on the number of persons at your facility. So your symptoms and bleeding gums or nose, for example, if someone is bleeding from their nose, if the person, however, is bringing up sputum that has blood in it, that will be reported. Headaches, joint or muscle pains, retrobulbar pain, meaning eye pain, or facial pain. Generalized rashes are also very important. We do take note of these things, blurred vision or other injuries. So when we look at the symptoms then generate into what we call our syndromes. So we have 6 syndromes, and then we have the multiple symptoms that we've just seen. So the symptoms now feed into the syndromes, and when the persons now input their into the reporting form, it now comes up with a syndrome on the TIS software. And then our syndromes have accompanying case definitions. So an accompanying case definition, as we looked at this now, we'll look into what can potentially be causing this syndrome. And it will also look at a listing based on the country and based on the individuals of what the diseases can potentially be. Now, our syndromes have their threshold values. So when we look at a threshold value, the threshold value is already inputted into the system and it is calculated for you. So for example, in many cases, you will get a gastroenteritis at some facilities because foodborne disease outbreaks can happen at hotels. Now, when you have that, it is calculated based on 2% or over of staff and guests at the facility at any given time. And that is when you will get an alert. So if it's below 2%, you will not get a threshold value alert, meaning that we will see the report, but we will not be alerted that this is an issue. For example, another case will be fever and hemorrhagic symptoms. One case alone is considered a threshold. Fever and neurological is also the same thing, one case. And the reason why that is happening is because if you think about it, it goes based on the diseases and the potential for outbreaks at your facility. So because we have specific diseases which have a higher risk of outbreak spread in a shorter space of time associated with these syndromes, we have specific thresholds set for one case being a notifiable alert. For your attack rate for gastroenteritis, as we went into this now, the system itself calculates everything for you. You do not have to calculate it. We do not calculate it either. The system will actually go based on the syndrome count, and then the denominator will be the number of rooms by occupancy rate. And if, for example, you have an average of 2 persons per room and the number of staff you have at any given time, if available. Now, the reason why we also ask that persons when they're registering for the TIS system, we ask that you indicate your low and your high season. This is why it is very important to have a good idea of when your low seasons are and your high seasons are in terms of your data, because it'll help us to now generate the most accurate attack rate for you when you do actually register into the system any problems you're having with GI disorders. Now you have 3 levels of users. As we spoke about earlier, you have your facility users, meaning at the hotel or the guest house. These will be both your administrative staff, so your data entry clerk or clerks, and your hotel management or your hotel nurse. These persons, meaning the hotel management and the hotel nurse, they will be able to access the full data and the full systems, Excel sheets and graphs. So they'll be able to determine if there has been a spike at any given time of the year So remember, we are also going based on our epidemiological weeks. There are 52 years in a week. So we go based on all 52. So the reporting takes place every week, and it will be able to showcase, okay, for example, if in the latter portion of the year, you have a rise in fever and rash, or fever and neurological, or fever and hemorrhagic, it may be an indication that you have dengue virus spikes. This indication of a dengue virus spike will go based also on the weather, because you tend to have more vector-borne disease issues during the rainy season. So a hotel manager or the hotel nurse will be able to now see this, and then that will be able to inform your further preventative measures. At the country level, you have your epidemiologist or your surveillance officer. He or she works at the national or the regional offices for the Ministry of Health. They will be alerted and they will be able to deal with the matter at a national level if need be. At the CARFA level, you have myself or Dr. Inda, who will be the epidemiologist, or Dr. Ms. Cyrus. All three of us will be able, if need be, to offer input or to analyze your data for you and to review anything if necessary. That may be an issue. So for example, if you're having an issue with reporting, then you can email us. Registration for the TIS system goes based on a Google Doc. So the Google Doc and the registration link have been provided for you. The computer then generates your login information and password. So when it is inputted, your information will be sent to you, and this will have your login credentials. You must use your login credentials correctly, and the information will then automatically be inputted, meaning that once you go into the system, you'll be able to start reporting immediately. So this is what the homepage looks like for the TIS system. So remember, when you're reporting, you have two types of reporting for TIS. You have the self-reporting, meaning the person can report a case, or you have the sign-in. So in the self-reporting feature, that now refers to if, for example, I have a traveler who's at my facility, I can make them aware of the TIS program, and they can report their own illness. The sign-in will be for your data entry clerk or for the manager. So for your self-reporting, to report one specific case, this is what the self-reporting page looks like. To report a case to the general public, it goes like, are you a guest? So you have to indicate if you're a guest, in which country is the facility that you are staying. So you will now indicate also the person, what country that they're in, the type of facility, and the facility's name. Any guest or staff member can self-report their illness using the online questionnaire, so that is also an option that we must consider. Guests and staff can self-report any problems that they have. And in additional cases, we have the normal sign-in, which most of you will be doing. The login page looks like this. So for your email, you'll be using the sign-in credentials that we would have sent to you. So one of the problems is that sometimes people will use their hotel facility or their personal email address when logging into TIS. No, the system will generate your login credentials. So use the login credential that comes with the new email and the new password. That will be your username and your password. Another problem we have had with some facilities, people may not realize under what type of facility and their sign-in. So many persons may, for example, put down CARFA, or they may put down tour operators when they are in fact a facility. So at the national level, they will sign in as country. At CARFA, we sign in as CARFA, and then based on what you register as, you can sign in as a facility, a tour operator, or a ground transport company. Now, one of the data entry model hotels that we use would be the Phoenix Resort. This is one of our hotels that we would have designed specifically for showcasing how to use the system. So it's not an actual hotel that we are showcasing right now. So yet again, I'm showing you where they say, are you a guest? In which country is the facility that you are staying in? And the type of facility is this? So you're putting in the general information. Now, one of the required fields also would go into age group, gender, and resident country. So the general information that you will need will be, yes, age and gender are very important, and we need that because remember, you're also building on what is the risk factor for the disease. You're looking at the individual person. When we look at the resident country, is the person coming from a country where an outbreak or endemic disease occurs. If, for example, let's say someone has come from North America and they are presenting also with rash, that can be an indication the person did not acquire the issue at your facility. They may have come to your facility already incubating a tick-borne disease, and now they are presenting with rash. So that is why we need to understand also the country of origin, if there has been any recent travel. When we look at recent travel, that is a very important aspect for travel medicine, because it looks at, is the person coming from a country where yet again there has been an outbreak or an endemic disease. In some countries, you will find that measles is a problem and persons may be presenting with symptoms indicative of measles. So that also as a travel history helps us to fine tune and understand what can be the potential problem. The symptom occurrence date, and then also it'll go into the symptoms, and persons are free to put on any additional notes if need be. So the case report that will be generated, an example will be, if you have the guest or staff, you indicate, okay, the guest, and in this case, we'll say the guest's name is Bob. So Bob has originated from country of or hotel. We'll say he's staying at the Phoenix Resort. So the country of hotel will be the Phoenix Resort, and you're looking at, let's say Phoenix Resort is in Belize. The type of facility, it is a resort. Facility name, Phoenix Resort. Bob's age will be 24. What is Bob's age group? The age group is already on the form. His gender, in this case, Bob will be a male. Country, home country. Let us say Bob originated from Canada and his recent travel may have been to the United States. Bob may have been involved in, let's say, ecotourism. So Bob normally tends to spend a bit of his time outdoors. Bob did not realize that a Rocky Mountain spotted tick, one of the ticks may have bitten him, because ticks tend to go very unnoticed on persons. Sometimes the clothing that we wear may not always be appropriate. We may not have used appropriate preventative measures, and then a tick bit into Bob. Within that period of time of the tick biting Bob, Bob would have then contracted Rocky Mountain spotted fever, Lyme disease, one of them. Bob then travels to one of the Caribbean destinations, and he is now in Belize because Bob has now come to a surfing tournament, anything, let's say that, and then Bob realizes he has a rash. If, for example, Bob has been on the beach, Bob's first impression may be that the beach may have the sunlight and whatnot, that could have been the cause. But then by him realizing also this rash may not be the normal for sunburn, he'll be able to now self-report, or he can come to the data entry clerk to report his issue. Then the information is then inputted into the system. So the reported date also goes in, the symptom onset, meaning when did his symptoms arise, the symptoms that he has, and any additional notes. So in the additional notes, you'll be putting in anything that Bob may consider to be important to the history. So that is important because it helps the epidemiologist to fine-tune and understand what may have been the problem here. In some cases, you'll realize that the fields are pre-populated based on the user login. So sometimes you may actually set, depending on the country facility type and name, and the reporting date will already be inputted for you. You don't have to change that. Once you have reported your data entry, the data is used to populate a report dashboard, and the symptoms that are reported during the data entry will be analyzed. So we have the 6 syndromes that we've spoken about, and yet again, we've just looked at any potential diseases that can come about from these syndromes. Now, let us say that I am yet again working at reviewing the dashboard. I now will log into TIS, and then I can go into the left-hand side, and for registered facilities that use the dashboard, it will be accessible to 2 members. So yet again, I'm looking at the management, or I'm looking at your data entry clerk. In this case, when I'm looking at monitoring the dashboard, that will be your manager. So your manager is able to now monitor what is going on. So if, let's say, he decides that for the start of year meeting, he wants to do a review of all quarters, he can actually generate that. So he can go at the year, meaning that you can apply filters. So one of the filters will be the year. So you can look at 2016, 2017 onwards, the start of epi weeks. So when we look at the start of epi weeks, as I said, we have 52 weeks that make our epidemiological weeks. So all organizations go based on epi weeks. So I don't report based on the dates, we report based on the epidemiological week. So you can say, yet again, based on the year and the time frame, you can say week 48, etc. And the end of the epi week. So you can say, for example, if you just want to focus on a specific time frame, you can say 2017 epi week 37 to 45. And that will then manifest on the system those specific weeks, and you will be able to generate what is going on at your facility. So it will give you an overview of all your reported syndromes over a specified time period. Now in this graph, we are seeing for weeks 1 to 52. Notice how you have different colors, and you also will get a breakdown of syndromes by your age groups and by your sex, by staff versus guest. So it is ideal also for that. Now remember, when we are looking at different colors, the different colors are based on the syndrome. So you have 6 different syndromes, you will have 6 different colors. You can actually focus directly on one of your syndromes. So we look at that later on, but if I just want to focus on gastroenteritis, I can close off the others and just focus on my gastroenteritis for the entire 52-week period or time frame that you're looking at. For your charts, you will get the number of reported gastroenteritis cases by the week, if need be, the number of reported other syndromes that you may have. You can also look at guest versus staff. Now remember, it's very important to know if you have guest issues versus if you have staff issues or both, because as I said before, this system also not only protects you, but also helps in developing sustainable development for your country. And a part of that means you need to be able to monitor and see what is the health security for my country. So if, for example, I know that I have a problem with dengue virus in my country, and I have my staff coming down with it, I want to be able to monitor and see, is this also going to be a problem for my guests? How do I now improve upon this? Do I have to use DET? What is the case here in terms of sprays? Should I offer sprays for sale at my facility? Should we increase, for example, our warning signage for dengue virus? You need to be able to have this information to input into your changes as need be. Another very interesting feature is you can hover over a bar chart and it will be able to indicate to you, for example, the full breakdown. So you're looking at, for example, 25 to 44 here, and it will then have the 45 age group, for example, 45 to 64, and it will have the full breakdown of the occurrence of the syndrome. So you can see that you had 76 occurrences of gastroenteritis, 71 occurrences of undifferentiated fever. The dashboard also has an export feature. So you can use your dashboard export feature to look at anything that's been going on at your facility on an Excel, or you can download the PNG file, download it as a JPEG. So you can actually use this as a form of reporting. So if, for example, you want to send a report to your facility manager or to anyone who is working with you on, for example, environmental health and sanitation or your local health facilities, you can export these graphs also. At the country national level, they will be able to have a summary table. So the summary table, for example, for Jamaica, if let's say I am the national epidemiologist for Jamaica, I will be able to then pull up the summary table, and the summary table will then help me to see if any specific facility or if any facilities within a specific parish have had any problems. We do have resources available, and I think one of these things that people feel overwhelmed by is that they say, okay, but the system may be difficult to use. We have step-by-step guidelines that can be printed and put at the computer that is used to input the data, that you can share with your data entry clerks. And also that you can always just have, for example, for your guest who will have to put the data in for themselves, if you want to show them how to use the app, which also has a self-reporting feature, or how to monitor and to register their own illness, you can use one of these instruction guidelines, and it is an actual step-by-step flowchart. The test also has a user manual, and we also have a poster design, which is yet again readily available on our website, which has an information pamphlet for visitors to your hotel. So are you feeling unwell? Is there a problem? And they can now use this information to know that they can report to the test. And it is also very empowering when our guests know that they are well taken care of and know that their needs are put first and foremost. We also have a YouTube video which goes specifically in how to use the TIS program. And anything else that is needed, one can easily email Ms. Cyrus, or I'll also put my email address in the chat box, Frank Moore. And you can, of course, email us if you have any problems with your TIS registration. Yes, and that's it. Anyone has any questions?
Thank you, Dr. Frank. We have posted on the chat a survey from CARFA that we would appreciate if you can complete to provide feedback to the CARFA team on the presentation today. We are very close to our time of closure for the session. Dr. Frank, can you go over the type of businesses that can currently register for this and those businesses type that CARFA will be adding later in the year?
Okay, so currently the Caribbean Public Health Agency has certain features. So we do have for facilities and different types of hotels, so they can register. Right now we have had ground transportation organizations, and we have also had tour operators who have been registering. So our app developer and the THP team recently met this week, and we have been able to make provisions in place for everybody to now use the resources. So he is putting it like a different filter per country, and is going to be updated in the next few days so that persons can not only look at hotels, but they could filter to look at specific tour operators or ground transport if needed. As for businesses, it will have to be that yes, we do have business and property management organizations which have registered, and they do register with TIS, and we have registered them into the system. But if the business, however, believes that they may have a specific, for example, need to be on the system and they may not understand if they fall directly into travel or tourism, they can also feel free to send their queries to me. So at frankmoore@carfa.org if they need any clarification.
Are attractions able to sign up on this?
When you say attractions, what do you mean? Like as in eco attractions or?
An attraction in general. It could be a submarine attraction. It could be a dolphin location, any sort of activity based.
We don't have that exact provision for certain and everyone. So I would advise yet again that persons, if they believe that they may be, let's say, unsure as to what they should do and where they fall, they can send an email directly to me. I will, however, say that we are making provisions in place for everyone. It is going to take a period of time, of course, because remember, tourism is a very variable thing depending on the islands. And then we also have to bear in mind that ecotourism is a very important factor people are trying to get back into. So we are expanding to different users, and they just need to just email and see where they fit into the equation.
I know we are at our closing time, but there was one question regarding the use of gloves, because there was not much reference made about it. What is your view on the use of gloves in the prevention of the transmission of the virus, especially as a front desk agent? Dr. Frank?
Right, so when you say the use of gloves, that's one thing I was a bit concerned about because I realized we get different questions on it. Do they mean gloves overall through the entire day or gloves in a kitchen setting?
This question was specific to a front desk, but if you can provide any feedback with regards to any food and beverage setting, it may be helpful to those that are joining.
Okay. Hi, Vanessa. I'm still here.
Hi.
So
really, CARFA does not really recommend the use of gloves unless you are in a high risk area, like, you know, as a frontline worker, or you are in a high risk for infection as a medical doctor, or so on, or you're using ready to eat foods and doesn't require cooking and so on. Because, and the reason, for the prime reason, is that gloves sometimes give you a false sense of protection. Gloves could only be used for one task. So for instance, let's say you're in the front desk, as they said, and you're using that glove. Every time you change tasks, you have to change a glove, which becomes very tedious. So if you go, you are seeing about one person, and then you decide to go to the printer, which is another task, you change your glove. So what we recommend is proper hand washing and sanitizing in those cases. You use gloves when obviously you want to do things like, you know, in the food service where you have ready-to-eat foods, like in your deli service and so on, or the food doesn't require cooking. Also, if you're using gloves to do one task specifically, you have to change it every 4 hours. And if you're using glove, once it gets torn or ripped, you have to change as well.
Okay. And Dr. Inder, since you are with us, and we'll just wrap up shortly. Operating a hotel business in Jamaica, we have visitors that are not comfortable wearing a mask on the beach as it is hot and humid. Would it be safe to be lenient with the mask wearing on the beach if they maintain the 6 feet physical distancing?
Yes, that's an interesting question. And I don't want to preempt, because, you know, the government of Jamaica does have a protocol of wearing masks unless you're in the water. So I don't want to preempt. Like, for instance, in Trinidad, it also says the same, you know, so that is something, you know, I don't want to preempt in terms of answering. Staying 6 feet apart is important. Yes, it's hot and humid, but the rule of thumb is that you wear a mask unless you're in the water. So, you know, you could also have, you know, formites and so on beach chairs. So you want to if, you know, you want to reduce risk as much as possible. And I understand it being hot and humid. I don't have, you know, I don't want to say don't wear a mask where the government has required to wear a mask.
And last question is, we have an individual that has been reporting cases for 3 weeks, but no data has been generated in the analytics tab. Why might this be?
Have there been reported cases or 0 cases?
It says just cases.
Well, if they're reporting cases, they would see data. If they're reporting 0 cases, there will be no graphs. That's why I'm asking. Because you can only have graphs or analysis when you have actual data. So when we say to report 0 cases, it means we want to ensure you're reporting. So even if you have no cases, still report, because it's a record that you're reporting. However, if you're reporting only 0, you can't see graphs because you have nothing to analyze. However, if that person is reporting actual numbers, meaning that 1 case of this syndrome or so on, they should see graph. And in that case, I would recommend that they write us immediately to let us know, because, you know, to see if there is any glitch anywhere. Those are things we would want you to write us immediately. Because we do know of other people who are reporting, and we, you know, from a regional point, we do see graphs and so on. So.
Perfect. One last question, and I appreciate everybody's time, and we'll wrap it up with this one. Before the guest enters a taxi, we recommend that they sanitize their hands thoroughly. What about their clothing, which would have been exposed to the virus as well? What type of methods can be used to disinfect sanitized clothing?
Yeah, we don't have that answer.
Very difficult.
How do you sanitize? How do you sanitize? This is why we encourage, you know, you have, and science is a bit complicated. You can't tell people to change of clothes, but you could tell them wear masks, because we know it's an upper respiratory tract infection. We know the greater risk is if they are talking, if their hands are touching the surfaces. This is why we say to, wear a mask and to clean and sanitize, and then all those high touch areas you clean and sanitize afterwards. Yeah.
Exactly. Well, we thank everybody for their time and for joining us during this last session for the year. Thank you so much to the CARFA team for all of the information that they have provided. As a reminder, the certificate of participation to those that checked in will be distributed within the next 30 days. If you have any questions in terms of how to receive the Healthier, Safer Tourism stamp from CARFA, you're welcome to visit the CHDA website under the Health Safety Resources, which will list all of the particulars for not only receiving the CARFA stamp, but also the World Travel and Tourism Council Safe Travel stamp and CHDA's exclusive listings. We will be resuming this session as well as other sessions within the Tourism Health Safety Training Series early in January. We want to take this opportunity to wish everybody season's greetings and remain safe. And we look forward to seeing you all next year. Thank you so much and have a great afternoon.
Christmas.